I have to thank Angelina for mentioning various issues. The most important thing, I think, that people are looking at disabled women, whether they have learning disabilities or physical disabilities, and they're using active listening. I think what she meant by listening to people. So yes, that's the title. This is me. A long time ago. I've grown older since then because my daughters were 4 and 8 at the time. These are my qualifications. See, I've been trying it, although I have this motto of disability, to live an active life as much as possible, with many problems, of course. So this presentation, which I will try to keep brief, is in 3 parts. I will present some definitions of disability and talk mainly about birth and motherhood, and present some research on disabled women in Greece and their birth experiences. And as an architect, I have some suggestions to make, which might be obvious to people who work in maternity, but might not be also obvious: how to improve birth spaces and birth care. Oops. Next one. Oh yeah, there it is. Yeah, so there's some different definitions of disability, but mainly it's a part of being human, having a temporary or permanent impairment that impacts most people anywhere in the world, like over 1 billion of people globally, which is increasing due to the aging of the population and the rising of young non-communicable diseases, mainly chronic diseases and neurological diseases or problems. There's various kinds of impairments, which are physical problems that are related to movement, mobility, vision, hearing, and mental disabilities or learning disabilities, as they're called in the so-called developed world. Thinking, learning, mental health issues, remembering, communicating, which affects one's social relationships. But of course, there are many other physical issues with blood, kidney, other internal problems, the immune system, which might lead to neurological problems. And in some cases, there's combined difficulties, challenges, and that's about 50% of the world population. So I'm sure most of you will have heard about this, the 2 different paradigms, the different models of disability. The most dominant or well-known one is the one by which to go by our thinking and our attitude to people. It's a medical model, which is based on the biomedical perception of health and illness or disease. And it links disability to one's physical body, mainly. It focuses on managing disability or managing symptoms, and it aims to improve bodily functioning or mental functioning in many cases. And in this model, the medical profession is central, has a central role. On the other hand, in the last 50 years or so in the Western world, there's the emergence of the social model of disability, and the idea being that disability is the result of an interaction between a health condition, a health problem, with social factors and with environmental factors, with social attitudes, social support, and the environment and accessibility and transportation. And both of those affect experience and the extent of disability, because they might present barriers to full and effective participation in social life. I have some nice images of disabled mothers becoming, enjoying motherhood. It's not always like that, but you know, they do exist. This is the main issue of my presentation. It's disability and motherhood. Disabled women were historically excluded from motherhood, seemed as deemed to be unable to have children or to raise them, or both. And combined with the trends of the increasing medicalization in birth, which affects disabled women even more, they face even a higher degree of exclusion. Not all of them, of course. There's some research that I have found during my short research, and it was mostly based in the Anglo-Saxon world literature. This is the issue I tried to research later. It's about the experience of maternity care during pregnancy, labor, and birth. So my focus was in the same issue in Greece, and based on my personal experience and personal perspectives, and focusing as an architect on birth spaces, which was what my PhD was about. Specifically hospitals and homes mostly, but birth centers, well, it's the idea of birth centers, because in Greece they do not really exist yet. The main challenges are the ones I think are probably well known anyway, is the societal biases and the practical barriers. So I have this table about the main findings of the survey. And there's 9 women, because it was a small qualitative study, so there's no reason or way to make it larger. And there were 9 women. There were 7 cesareans, so a very high percentage. At the hospital births, there were very high intervention rates with a C-section of 87%. In Greece, it's about 64%. From as of 2018, I think it's higher now. But for disabled women, it was even higher. And with breastfeeding rates being very lower than the general, the non-disabled population, women population. And this did result in reduced confidence for the women and limited autonomy. I also had the small control group of 3 home births. Well, they were all my personal, if not friends, personal acquaintances. But anyway, in these home births, there were no interventions. They were all natural births. They had high breastfeeding rates, and mothers felt empowered by the birth experience. Still, in Greece, this is more or less the same as in the non-disabled population of women. They have the same results. But still, even for non-disabled women, home birth rates in Greece are still very low. They are less than 1%. They increased slightly during the lockdowns because there were very bad services for pregnant women. Anyway, as a mother of 3 and with 2 home births and research on birth spaces, my solution for this problem is the creation of birth centers, or the more intensive use of those where they exist, like in the UK, Germany, and to an extent in the Netherlands, but they still have some home birth rates. Especially in the extremely medicalized birth landscape of Greece, the creation of birth centers may offer disabled mothers the medical care they need, the birth experience they want, because they're both very important. They usually need more medical care or more support than the general population, let's say. And they can be empowered as new mothers more by this kind of care. Support, foster their autonomy and self-confidence, and in my view, these are the most important benefits of birth center. So this is my professional qualification. I think that there's should be do some research on the environment, the environmental qualities of each space, birth space, from different ways, different problems, especially mobility challenges, which a birth space, a birth setting with flexibility and ergonomic equipment can support women who have difficulties in moving around, walking, standing, whether they can stand or not, and can help them have the birth experience they need and have. For other, like the hearing challenges, there's no, these women usually do not have mobility issues, so they can use the environment the way they need to be, but still there need to be some extra attention, some extra considerations about them, like pay attention to visual cues and have tactile feedback, and perhaps more than other people, hard of hearing women or even deaf women can respond or need to have a pleasant acoustical environment with nature sounds or even classical music, because as I've been told by deaf mother or semi-deaf mother, they can respond to vibrations, so it can create a soothing atmosphere. These are guidelines from a UK paper I found a couple of years ago. One for a mother with vision challenges, they can benefit from orientation tours, visiting the hospital they will give birth, or the birth center. They need to have opportunities to touch the instruments, to touch the equipment, and also that would be beneficial if they can listen to fetal heartbeats, not with an ICG, but the stethoscope, something that's more tactile and more physical, and not so much based on visual cues. For example, the snoozer rooms, which, as far as I know, do exist in several parts of the world. Occasionally, I have heard of one being created in Greece. This is a statue of Alison Lapper. I included that because it was in Trafalgar Square where Nelson's column was before. I think they took Nelson's column down and they put this statue there, which sort of was a kind of an inclusive ideal, because this mother has deformed limbs due to the thalidomide drug, the thalidomide disaster. But she managed to have become an artist and have a child, and kind of heroine, let's say, ideal. So my suggestions, my final thoughts are that there's a need, well, urgent or not, I'm not sure. Anyway, for systemic changes in maternity care for disabled women, first of all, to acknowledge their existence as in Greece, and acknowledge their need to have support, to have an inclusive and empowering model of care, especially midwifery care. I'm very what's to say about that, because it does not really exist in Greece independently. Midwives in Greece are usually obstetricians assistants. So I really think that this is very important. And kind of, well, employ a model of care that emphasizes dignity, support, and autonomy for disabled women. And as an architect, I would suggest that birth centers can function as transformative spaces to assist a disabled mother in her journey to motherhood, to become an autonomous and, let's say, well, not happy necessarily, but have a satisfactory transition to maternity. It can be done. I have done it 3 times. So, thank you.